What we found is a discovery that p53 mutations, loss of function, is correlated with overexpression of a receptor called PD-L1, which is really the hot pathway right now for immune activation. There's a lot of PD-1, PD-L1 drugs out. There's a lot of excitement about testing these drugs and trying to figure out who they work in. And p53 has been known for a long time to be mutated in the vast majority of cancers, but we really don't know what to do with it and how to target that, to use it to tailor therapy, which is what we want to do. And so this really ties those two fields together. p53, which we've known about for a long time, really don't understand the right way to therapeutically target that, and then tying that into this new exciting PD-L1 immunologic pathway. So, and what we did is not only make that correlation, but really figured out the mechanisms of how those work together, of how PD-L1 loss, specifically through which microRNAs regulate the PD-L1. So we really teased out a lot of those little pieces that tie those two pathways together. Now there are PD-1 and PD-L1 drugs that are out and approved, so there are actually some interventions that are be able to use for this targeting of the pathway. So the PD-1 drugs were first approved for melanoma, and they were recently approved for lung cancer. And this meeting has data on a lot of new tumor sites that they'll be approved in, so I imagine a lot of the solid tumors will have PD-1 or PD-L1 drugs approved in them shortly. There's a lot of excitement to see what other tumor histologies they work in. Myself, I specialize in lung cancer, and there was a lot of people that were, thought maybe this would only work on the melanoma side where the immune system is very important, but it may not have such quite a big role in the lung cancer world. And we found out it does. It's quite important. These drugs appear to have clear benefits. I think we'll start to see some survival benefits coming out shortly.